For Carrie Ann Inaba, dancing is not only her livelihood, it's also a way of life. So when one of Hollywood's most notable dancers and choreographers suddenly found herself feeling different and not having enough energy to get through the day, she knew something was wrong. Here to tell us more about her story and the story of many others are Carrie Ann Inaba and Dr. Stephanie Martin. Welcome, you two. Happy to have you here.
Thank you for having us.
Thank you.
Carrie Ann, I'm a big fan of yours. I want you to tell us your story of living with what's known as IDA and why you're here joining this Get Iron Informed campaign exactly.
I love that you've given it a nickname. It's IDA, and it's iron deficiency anemia. And thank you so much for having us, because we're really excited to share this campaign, which is sponsored by Daiichi Sankyo. We've partnered up with them to help spread the word about iron deficiency anemia. I myself struggled with it a few years ago. About 6 years ago, I was diagnosed with it. And like you said earlier, I had brain fog, I had fatigue, I had a lot of pain in my body, I had anxiety. And I want to spread the word because it was very hard to get my diagnosis. And so I want to encourage people to have conversations with their doctors so that they can get the proper diagnosis. It's 1 in 4 people worldwide struggle with IDA, and that's a very high statistic. And yet it's quite common that it's underdiagnosed. And so we don't want that to happen anymore. We want people to take charge of their health and ask the right questions and learn more about iron deficiency anemia. It's called Get Iron Informed for a reason.
Makes sense. And Dr. Martin, why might someone be at risk for IDA?
Well, there are a lot of things that put people at risk for IDA that are very common, which is why this is such a common disease. Over 5 million adults in the United States have IDA. So women who have heavy menstrual cycles, maybe because of fibroids or have had heavy bleeding after they had their baby, patients who have inflammatory bowel diseases like Crohn's disease and ulcerative colitis, bariatric surgeries, weight loss surgeries are very common these days, and that causes problems with iron absorption, so it doesn't get into the bloodstream. So a lot of those patients will have IDA, and also people who have chronic kidney disease and cancer. So a lot of different conditions put people at risk. So it's very important that you have that conversation to see with your doctor to see if you need to be tested.
And so what symptoms should people be on the lookout for so that they know to go and talk to their doctor? Does everyone sort of have the same symptoms?
Well, there are a lot of symptoms that come along with IDA, including, like what Carrie Ann described with fatigue, extreme fatigue, brain fog, anxiety, depression. Interestingly, some patients will crave ice, which can be kind of dramatic. But the symptoms can also be mild, like just some fatigue, maybe your heart's racing, you're short of breath. But it's important that people understand that you may have no symptoms at all and still have IDA. The only way to know is to check your blood count. So we strongly encourage people to talk to their doctors and go to getironinformed.com to learn more about IDA and get help in having that conversation with your doctor.
All right, Carrie Ann Inaba and Dr. Martin, thank you so much for being here and shining light on this issue. Really appreciate it. And we'll be right back with more Midday Maryland right after this. Stay tuned.